the first session being a discussion on the basics of heart failure, and the second session a discussion on therapeutic choices pertaining to the management of heart failure. Heart failure is the inability of the heart to supply adequate blood flow and therefore oxygen delivery to peripheral tissues and organs. Underperfusion of organs leads to reduced exercise capacity, fatigue, and shortness of breath. It can also lead to organ dysfunction, for example renal failure seen in some patients. Heart failure is a clinical syndrome caused by disease or other abnormal conditions in the body. Heart failure can be caused by factors originating from within the heart, that is intrinsic disease or pathology, or from external factors that place excessive demands upon the heart. Intrinsic disease includes conditions such as dilated cardiomyopathy and hypertrophic cardiomyopathy. Now, before we get to discuss pharmacologic choices, let's talk about drug-related considerations. Drugs may increase the cardiac ejection fraction by directly stimulating cardiac contractility. The use of positive inotropic agents such as dopamine, dobutamine, and milrinone can produce immediate benefits. However, the long-term benefit has not been appreciated and in some cases may actually increase morbidity and mortality. Pharmacologic choices in the management of systolic heart failure. In the absence of contraindications, the cornerstone of therapy for systolic heart failure in all patients with a left ventricular ejection fraction less than or equivalent to 40% is long-term treatment with the combination of an angiotensin-converting enzyme inhibitor and a beta blocker. Here again, diuretics are used to control signs and symptoms of hypervolemia. Neseritide is a recombinant form of the human B-type natriuretic peptide, which is a naturally occurring hormone secreted by the ventricles. Neseritide is approved for the intravenous treatment of patients with acutely decompensated heart failure associated with shortness of breath at rest or with minimal activity.